Howdy, future nurses. Are you prepping for your NCLEX next month? Are you NCLEX ready? Don't skip this video. We have 20 questions to review. So let's start with question number 1. A client with hypothyroidism reports fatigue and cold intolerance. Which finding aligns with the condition? So I'm going to have a 10-second timer here. Then I will reveal the correct answer. Okay, so the correct answer for question number 1 is letter D. Hypothyroidism slows metabolic activity, often producing a slower heart rate. A is incorrect because rapid speech reflects increased metabolism. B is incorrect because warm, moist skin occurs in hyperthyroidism. C is incorrect because weight loss contradicts expected weight gain. Let's go to question number 2. A client receiving IV potassium, of course in an infusion, reports burning at the IV site. What action supports safe infusion? Here is your 10-second timer. The correct answer for question number 2 is letter B. Dilution decreases irritation and is an expected approach with potassium administration. A is incorrect because increasing the rate worsens vein irritation. C is incorrect because moving to a smaller vein increases discomfort. And D is also incorrect because adding more potassium raises the risk of hyperkalemia, plus you need an order for that. Question number 3. A client with COPD has an O2 sat of 88% on room air. Which action supports oxygenation? Ten seconds. So if you selected A, you are correct. Upright positioning improves lung expansion in COPD patient. B is incorrect because excess fluids risk overload. C is also incorrect because lowering the bed decreases ventilation. D is incorrect because protein restriction does not improve oxygenation. Let's go to question number 4. A client receiving warfarin has an INR of 4.8. Which assessment is most important? The correct answer is letter C. INR of 4.8 increases bleeding risk. Gum bleeding indicates excessive anticoagulation. A is incorrect because appetite does not evaluate bleeding risk. B is incorrect because temperature changes are unrelated. D is also incorrect because bowel frequency does not assess anticoagulation. Question number 5. A client with heart failure reports sudden shortness of breath at night. Which finding supports pulmonary buildup? Ten seconds. Okay, so the correct answer for question number 5 is letter D. Pink frothy sputum is a clear sign of pulmonary edema. A is incorrect because warm hands do not indicate fluid overload. B is incorrect because bowel tones are unrelated. C are also incorrect because clear lungs contradict expected finding. So I'm new here on YouTube. If you're also new in this channel, please subscribe to this channel because I'm going to be creating questions daily. Okay, question number 6. A client with type 1 diabetes reports shakiness and sweating. Which result supports hypoglycemia? 10 seconds. Okay, so 10 seconds is up. The correct answer is letter B. Anything below 70 confirms hypoglycemia. A is incorrect. 155 is really elevated. C is incorrect because 128 is normal. And D is also incorrect because it's a sign of hyperglycemia. Let's go to question number 7. A patient with pneumonia has a respiratory rate of 30 with accessory muscle use. Which finding shows worsening work of breathing? Ten seconds. Okay, so the correct answer is letter C. Inability to speak normally indicates increased respiratory effort. A is incorrect because strong pulses don't reflect ventilation. B is also incorrect because skin warmth is non-specific. And D is also incorrect because stable blood pressure does not indicate severity of respiratory distress. Let's go to question number 8. So a client taking metformin reports nausea after meals. Which finding requires follow-up? Okay, so correct answer is letter A. Fatigue may indicate lactic acidosis, a rare but serious adverse effect. B is incorrect because normal appetite does not signal concern. Letter C, clear lungs are expected, so that's why it's incorrect. Letter D is also incorrect because stable weight does not indicate rest. Question number 9. A client with severe dehydration receives IV fluids. Which finding shows improving volume status? 10 seconds. Okay, so D is the correct answer. Normal capillary refill indicates improved perfusion after fluid therapy. A is incorrect because low urine output indicates ongoing deficit. B is also incorrect because sunken eyes reflect fluid loss. C is incorrect because dry mouth shows continued dehydration. Question number 10. Let's go to question number 10. A client with acute pancreatitis reports increasing abdominal pain. Which lab value supports worsening inflammation? Okay. Okay, so B is the correct answer. Elevated lipase strongly supports pancreatic inflammation. A is incorrect because that's normal potassium does not really reflect pancreatitis. C is also incorrect because the sodium is normal and it's unrelated. D is also incorrect because a normal hemoglobin does not indicate severity. Okay. So I'm new to YouTube, so I'm learning all these things. So if you guys can subscribe, that would be better. So question number 11. A client with Addison's disease reports dizziness. Which finding supports possible adrenal crisis? Okay, the correct answer is letter C. Low blood pressure occurs when cortisol and aldosterone are insufficient, consistent with adrenal crisis. A is incorrect because warm skin is non-specific. B is also incorrect because elevated glucose contradicts expected hypoglycemia in adrenal insufficiency. D norm is incorrect because normal rhythm does not really indicate decompensation. Okay, so let's go to question 12. A client receiving digoxin reports nausea. Which assessment supports digoxin toxicity? Okay, so 12, the correct answer is letter A. A slow heart rate strongly aligns with digoxin toxicity. Tachycardia is not, so B is incorrect. C is also incorrect because warm skin is unrelated. D is also incorrect because strong pulses do not really confirm toxicity. Okay, go to question 13. Let me make sure we're going to be in the center. Question 13, a client with COPD becomes confused. Which lab value supports worsening respiratory acidosis? Okay, it's question number 13. Okay, so question number 13, the correct answer is letter D. A low pH reflects acidosis consistent with CO2 retention. So A is incorrect. Normal sodium is not does not indicate acid-base imbalance. Normal glucose, letter B, is also incorrect, and letter C is also incorrect because of normal potassium. Let's go to question number 14. A client with UTI reports flat pain and fever. Which finding supports progression to pyelonephritis, so infection in the kidneys? Okay. Okay, correct answer is letter B for number 14. Costovertebral tenderness is a hallmark sign of kidney involvement. Clear urine output contradicts infection, so A is incorrect, right? C is also incorrect because stable temperature does not indicate worsening conditions. D is also incorrect because appetite changes are non-specific. Question 15. A client with new onset confusion has a sodium of 120. Which additional findings support severe hyponatremia? Okay, the correct answer for 15 is letter C. Seizure signals dangerous cerebral swelling from severe hyponatremia. A is incorrect. Hand warmth does not really reflect sodium levels. B, normal speech contradicts with neurological failure or deficit with hyponatremia. D, bowel sounds is also incorrect because bowel sounds are not related. So we're question number 15. Let us know where you're watching this video in the comment section, what part of the world you're watching this. Let's go to question number 16. A client with anemia reports fatigue. Which lab supports impaired oxygen carrying capacity? So oxygen carrying capacity. Okay, A is the correct answer. Low hemoglobin limits oxygen transport, causing fatigue. B is incorrect because normal potassium is not really related to oxygen delivery. C is also incorrect because normal sodium is unrelated. And D is also incorrect because calcium level does not really explain fatigue. Okay? Let's go to question 17. Client with DBT reports shortness of breath. Which finding supports possible PE or pulmonary embolism? Okay, correct answer. Letter D, sudden chest pain with dyspnea is classic for pulmonary embolism. A is incorrect because normal respiratory rate contradicts expected respiratory compromise. B is incorrect because pink skin is non-specific. Letter C is also incorrect because strong pulses do not evaluate clot migration. Let us go to question 18. Question 18, a client with C. diff has frequent watery stools. Which finding warrants concern? Okay, number 18, correct answer is letter B. Rising creatinine indicates dehydration and possible kidney stress. A is incorrect because mild thirst is expected. C is incorrect because hand warmth, again, is very non-specific. Letter D is incorrect because stable blood pressure does not reflect severity. Let's go to question 19. A client receiving albuterol reports tremors. Which finding shows expected medication effect? Yay! Correct answer is letter A. Albuterol improves airflow, reflected by improved breath sounds. A is incorrect. Appetite is nothing to do with albuterol. C is also incorrect because skin changes are unrelated. D is also incorrect because albuterol usually increases, not decreases the heart rate. Okay? And let's go to question number 20. A client with shock receives fluid resuscitation. Which finding shows improved perfusion? Okay, the answer to the question is letter C. Warm skin and strong pulses indicate restored circulation after fluids. A is incorrect because it says low urine output. That means poor perfusion, right? B is also incorrect because lactic level is going up. That means the patient is not getting any better, perhaps going into shock. Letter D is also incorrect because slow capillary refill shows inadequate flow. So that's our last question for this round. Thank you very much for watching. If you can, please subscribe so that I can post video every day. Thank you for watching.